Good to see you. I will ask you, if you would, to introduce yourself and your associate, and then, of course, the question is, can you operate within the mayor's proposed budget? And then after that, the floor is yours for any comments or anything you would like, any presentation you'd like to make. Thank you.
Good afternoon. I'm Joe Webb. I'm the CEO at Nashville General Hospital. This is next to me here, David Sullivan, our interim CFO. And the question is, can we operate and survive within the budget that the mayor has proposed for us? And the answer to that is yes, we can. Just a couple of things that we're planning to do at the hospital through the course of the year is we plan to grow the revenues of the hospital through clinic operations. We plan to improve the payer mix through clinic and hospital operations. We plan to modify the cost structure, and that is a way of saying control cost, not necessarily reduce cost, but we will expand revenues and get a better return on the cost that we are applying to the operations, and deliver high quality care and more abundant care to the community at a much higher level of quality. In addition to that, we also plan to serve as advisor in whatever capacities we can to the city as it relates to utilization of health resources, costs associated with health insurance coverage, and we will be applying that to ourselves initially as a part of our population health initiative, the hospital itself. I'll be happy to answer any questions that you might have.
Thank you. Council Lady Weiner.
Thank you. Thank you, Chair. Thank you, Mr. Webb, for being here. We appreciate it. I have already mentioned this to Mr. Cooper and Mr. Riebling. We have no line item information from either a revenue or an expense perspective. And I know from my standpoint, it would certainly help me know where we are currently and a benchmark by which we might compare the improvements that you do make in the future. So I would request, Mr. Riebling, if we can get that. That's all I've got. And when can we get that?
This year or next?
Yeah. Don't be funny.
Will they say this year's budget or next year?
Yes.
Yes. We just need some financial, kind of year-to-date financial stuff, and then has the hospital authority approved a budget for next fiscal year with this subsidy, based on this subsidy? Okay, so we just need a copy of what's been approved. Yeah, we can get all that. We'll talk tomorrow and we'll get it figured out.
Thank you. And welcome aboard.
Thank you.
In terms of,
One moment, please. Yeah.
if I can, when I'm ready, when you're
Okay.
ready for me.
All right. Are you just who?
I'm Jan Brandis, and I'm the Vice Chair for the Hospital Authority Board, and we are deeply grateful for the Council's funding and for the opportunities that we've had to expand in terms of electronic medical records, which have put us in a better position to really bill and to get higher percentages for our billing. There's so many initiatives. Mr. Webb is really being modest that since he came, there have been so many initiatives that have really started. And we would welcome, on the part of the hospital authority, we would welcome the opportunity to be very transparent about how we're spending the money and what it's going for, how it's been allocated. There are a lot of changes now underway in terms of retraining employees and putting together a compliance structure that I think will make it, again, Mr. Webb's really been behind this, but putting together a compliance structure that will make this one of the, if not the most compliant public hospital in the country. So there are many initiatives, and they are, as you know, they can be expensive, and certainly the big commitment has been to this conversion to electronic medical record and to these essentially being able to put the reimbursement plans into place. So again, we would welcome, and Mr. Riebling will know how to communicate that with our CFO. But we really would like to be as transparent as possible. We are deeply grateful for your support, and I think the employees are very happy to see the leadership that we now have. So on behalf of the authority, we thank you.
Thank you. Council Lady Weiner, you have any other?
Only to know that we'll be getting it here in short order. That's all.
Yes, we will. Councilman Glover.
Thank you, Mr. Chair. I pushed my button because I don't have specific questions for the hospital authority. I do think it's exceptional that you're looking for ways to generate additional revenues. I also know that the funding we give you is less than when I first came on the council, so you're to be commended there for the work you're doing. I do have questions once you finish this, Mr. Chair, and that's why I pushed the button, just to make sure we could have a little conversation at the end. Thank you.
Okay, Councilman Claiborne.
Thank you, Mr. Chair. Mr. Riebling, what is the subsidy this year?
Proposed or current year?
Being proposed.
$35 million.
And the current year?
Same.
The same, okay. And so help me remember going back through just this term.
It was about $50 million at one time.
Okay, so last year when we transitioned out Bordeaux and Knowles, then that made a significant dip in the subsidy, right?
Yes, sir. We are still in the process of phasing that out. For fiscal 16, there will still be a subsidy for Bordeaux and for Knowles, but that ends at the end of fiscal 16. And so so a portion of the authority's $35 million goes for that this year, but starting in fiscal 17, that no longer will be the case. They'll be completely, the city will be completely removed from Bordeaux and Knowles.
So will that then reduce the subsidy then even?
Well, that would be for this council and the next mayor to make that decision, but yeah, conceivably.
Logically, that would.
Conceivably, they could, unless they, obviously, the alternative is the authority can convince you that there's merit and good use for that money, but that's really a next year issue, yes, sir.
Okay.
But conceptually, it could go down $3 or $4 million, because that's, I can't remember the exact amount, but roughly $4 million, between Knowles and Bordeaux, it's probably $4 million next fiscal year.
Right. So we made significant progress since 2007 when I first took my seat, and you took your seat.
Yes, sir. I mean, as you might remember, not only did we have the subsidy larger, but we were also had a bunch of deficits that we were that literally we wrote off, about $50 million in operating losses, which the city just wrote off. And then together we have worked to stabilize the institution and like Vice Chairman Brandis said, we are optimistic that with the leadership team that we have now in place, that we're going to see it only getting better and providing a lot of good critical care for the citizens of Nashville.
Right. You all have our good hopes.
Thank you.
Council Lady Langster.
Thank you, Mr. Chair. I wanted to ask Attorney Cooper a question. John, is it possible, since we don't have any financial information in front of us, could they come back at the end when we catch, those departments that missed their hearing, or is it possible he could come back? Because I would like to hear some explanation to some of the way that the funding is being proposed. Is that a possible?
It's up to the committee.
Well, right now, everyone has been on schedule, so there isn't a lot of time for anyone that's missed any committees.
Well, what about, can you add him to the end of we only have, 2 that day, the last day?
Well, the school board, which will last quite a while.
Yes, sir, I know, probably about 2 hours.
So.
Well, could we take him one day near the end, because we have nothing to judge by. We have no numbers at all.
Well, I think what we might be able to do is coordinate when they get when we receive the information, and in their office, if they're willing to, if there's some point they want to make another presentation about that, the budget or whatever the figures that they presented us and Council Lady Weiner.
Can we not set a date now?
There's no way I can set a date now with the calendar. We don't know when. I don't know when the next open date will be, and we have to schedule it with them, and when we have the information from the hospital authority.
Well, I hope
it
that will be
off.
very shortly, but can
no,
somebody
we can't
work
do it
on
now.
it? Can we work on it so we can get on our calendar and they can get on theirs?
We'll investigate it and see what can be done.
Okay, because we
Sure.
really don't have anything. at
I
all.
understand.
Okay,
I understand.
thank you. They can do that.
Councilman Claiborne?
I'm going to ask the elephant in the room question. Why don't we have the financials that all the other departments have presented to us?
Well, let me say that typically, I'm not sure what we have in the past. I mean, remember now, this is an operation where the city just provides a subsidy to the entity, and the entity, through the hospital authority, does their own budget in terms of, the revenues and payer mix and things of that nature. So I'm not sure, I'd have to think back, I'm not sure you're getting anything really other different than what you've had before in the terms of what's important to the city is what the subsidy is, which is the $35 million, which is flat. That said, the request has been made for some financial data, which we're happy to get for the council. I'm not sure that's been shared in the past, but that doesn't mean we can't do it for going forward. So we will get that information, and if the council needs some time to digest it and want additional time to discuss it, we're happy to make everybody available.
Thank you, Mr. Friedman. Seeing no other members in the queue, that concludes the presentation. Thank you, Doctor, for being here.
Thank you.
Yeah, I'm not. I was waiting for them to leave.